Hello class, Dr. Mike Burford here again talking with you today about psychopathology and in particular talking about personality disorders. And I want to remind you that our information today of course comes from the DSM-5 as that's what you will be using in your work as clinicians, at least for those of you who plan to go into clinical practice. So we want to start off with a definition of personality disorder. You may have heard people talk about personality disorders and make some kind of declarative statement that so-and-so has a personality disorder. And of course that person may or may not know what they're talking about. So personality disorders are like the other mental health disorders in that oftentimes the phrase is thrown around loosely by people who in reality have little idea of what a personality disorder is. Anyways, a personality disorder is an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture. It's pervasive and inflexible. It has an onset in adolescence or early childhood. Could be early adulthood as well. And it is stable over time, this disorder, and it leads to distress or impairment. In the DSM-5, there are some significant changes that are different from the DSM-4-TR. And in the DSM-5, we have two sections on personality disorders, which is kind of odd. And when I first saw it, I thought, well, why in the world do they have two sections? So basically what it is that it's two different viewpoints about personality disorders from two groups of scholars. And the personality disorders presented in Section 2 represent updates on personality disorders that were in the old DSM-4-TR, the DSM-4 text revision. And we will use this section for our studies. They're commonly accepted disorders and they have been updated. But the interesting thing is that as science marches forward, we begin to understand more and more about various disorders, including personality disorders. And so I wouldn't be surprised when the next edition of DSM comes out that the DSM or that the personality disorders in Section 3 are prevalent and all of that. But at the time that the DSM-5 was published, some research needed to be done, further research needed to be done on the way of looking at personality disorders that's represented in Section 3 of your DSM-5. But there is contention that this new emerging model may more accurately depict personality disorders. And so I guess we'll stay tuned for that and see what comes of it. It'll be interesting. If you're like me, you're probably interested in personality disorders, and they are pretty fascinating. Okay, so when we're talking about personality disorders, we're talking about clusters of disorders. We can cluster them, we can group them. And so we basically have three clusters or three groups of personality disorders. In cluster A, or the first cluster, the first group, we can categorize these disorders together and say that people with these disorders frequently appear odd or eccentric. There's obviously something that's different and dare I say wrong with people that have these disorders in this cluster, and that would include paranoid, schizoid, schizotypal personality disorders. And later in this lecture, I cover some of the disorders that I see commonly, or well, I shouldn't say commonly, I don't commonly see people with personality disorders, but occasionally I'll see people that have personality disorders. It's not like that they're there every day, but when I do see them, it's usually one of three different types of disorders, and those will be the three that I cover later in this lecture. But information about paranoid, schizoid, and schizotypal personalities is certainly to be found in your DSM-5 if you're interested in reading about those. I don't recall having ever seen a client with either of those three disorders. Well, maybe the paranoid, but certainly the schizoid and schizotypal. I don't recall having seen anyone in clinic with those disorders. And indeed, schizoid and schizotypal personality disorders can be, at least at first glance, difficult to differentiate. And I'll leave it to you to look at the DSM to ferret that out. If I remember correctly, one has the presence of some delusional type thinking or pretty severe cognitive distortions or something to that effect. But again, I don't remember which is which. You'd have to look that up. All right, so for cluster B personality disorders, we see that these people with these disorders frequently appear dramatic, emotional, or erratic. And cluster B type people are the ones that I've seen in clinic for psychotherapy on occasion. Now again, I haven't seen a whole lot of them in that present specifically due to their disorder. Interestingly, I've known a couple of people in my life, my personal life, that had these kinds of disorders. I'm thinking of two people right now that have had these kinds of disorders that I've known. And so these disorders include antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Okay, so for cluster C type personality disorders, we have people that frequently appear anxious or fearful. These types of disorders include avoidant, dependent, and obsessive compulsive personality disorders. And I have known at least one person that had obsessive compulsive personality. So for personality disorders, there's some general criteria that are important to mention to you and for you to think about when you're thinking about personality disorders. There's an enduring, inflexible pattern of cognition, feelings, and behavior that go along with a personality disorder. So the key terms here are enduring and inflexible patterns of cognitions, feelings, and behaviors. Interpersonal functioning and or impulse control problems are the types of behaviors that I'm talking about. And these enduring and inflexible patterns significantly deviate from cultural norms. So these people are different, noticeably different oftentimes. Especially if you get to know them, you begin to realize that people with these personality disorders are quite different from what we would expect in our social norms, and can be quite rigid with their patterns of thinking, feeling, and behavior. The patterns that we're talking about here lead to impairment and dysfunction. For instance, I know someone right now in my personal life who has a personality disorder. Actually, I know two people, and they are quite impaired in terms of their ability to lead a happy, productive, what we would call normal life. Now, that's not to say that in some ways they don't function. In some ways they do, and in some ways have achieved pretty well, but yet there's still the personality disorder that keeps them from being happy, or at least in some ways happy. So people with personality disorders, it's said that that they are egocentric, meaning that that they enjoy and or like having the personality that they do, that they don't see that they have a problem. And I don't know that I buy that. I guess with human beings, there's so much variability. With some people, that's probably true, but I certainly wouldn't want to make that broad general statement, because the two people that I know with personality disorders are both quite unhappy in a lot of ways with their life. And I think they both have enough awareness to realize that indeed there is something wrong that's impeding their ability to be happy and satisfied in life. However, they rigidly adhere to the pattern of dysfunction that they've got, and in some ways appear to find comfort in it. So it's a bit of a quandary, a conundrum, if you will, because on one hand, they appear to find comfort in being certain ways, but yet on the other hand, it really disrupts their lives. Now, I can also think of a couple of examples of people that I know or have known that that enjoy, well, I wouldn't say enjoy, but that see themselves as being perfectly fine, although they're having some problems. They don't identify as having a personality disorder, or they don't dislike the way that they are. In fact, they quite like it. They just don't like some of the problems that are attached to their rigid and their inflexible way of thinking and behaviors. All right, so back to general criteria. Onset can be traced back to adolescence, or in most cases earlier. We want to rule out the impact of mental disorders and substance abuse. So now I want to talk about some of the actual personality disorders, since we have a rudimentary understanding or a basic understanding of general criteria for personality disorders. We'll begin with antisocial personality disorder. And my guess is that you have probably heard of antisocial personality disorder. It's gone by other names in the past, such as sociopath. Okay, so with antisocial personality disorder, we have a disregard for and violation of feelings and rights of others. And that's the number one defining factor, in my opinion. People with antisocial personality disorder tend to lack a conscience and are very self-serving and usually could care less about the rights and needs and feelings of others. People with this disorder are 18 years of age or older, and in fact, it's most likely not appropriate to diagnose somebody as having a personality disorder that's under the age of 18, the idea being that their personality is still developing and that that who they are just in general is still developing. So we can say that with antisocial personality, we have research that shows us that people with conduct disorder, especially if it's childhood onset conduct disorder, are much more likely to develop into adults with antisocial personality disorder. People with conduct disorder, adolescent conduct disorder, sometimes grow out of it. But anytime that you have a child with conduct disorder, there's some serious concern there that that person eventually will be an adult with antisocial personality. The other thing I'll say about antisocial personality is that these are the people that you tend to see in the jail system. At least a lot of the time, you see people like this in there. These are habitual criminals, people that do bad things to other people, intentionally do bad things, and habitually do bad things to other people. Characteristics of this disorder include failure to conform to rules, laws, and also they tend to have a blatant disregard for societal expectations and norms. These people tend to be deceitful. They tend to be impulsive. They tend to be aggressive and can be irritable. And when I mean aggressive, I'm talking about physical aggression. They can be reckless and put both themselves and others in danger. They tend to be irresponsible, and they tend to lack remorse, like I was saying earlier. A couple of people that I'm thinking about with antisocial personality disorder. One would be, we can think of extreme examples actually. One would be Dennis Rader, who was is a serial murderer, and has given there's some videos of him from when he was in court, and there's also a video of him after he was placed in jail doing an interview. And you can listen to this person, and if you read about the history that he has or hear about the history of families that he slaughtered, and that he stalked and slaughtered, and women that he stalked and slaughtered, when he talks about his crimes, he has no remorse. I mean, it's just like talking about washing your car that day or something. There's very little feeling, if any at all, in there. And another person that comes to mind is Richard Kuklinski, which is his nickname was the Iceman. He was a contract killer for the mafia, and he supposedly killed up to several hundred people. Now, I would imagine that's probably a bit exaggerated, but there's several different interviews of him, the best of which is done by Dr. Park Dietz, which is a forensic psychiatrist. And in that interview, Richard Kuklinski is quite forthcoming and blatantly says that he has no remorse. Well, let me rephrase that. Says that he has no sorrow for killing others, with the exception of perhaps getting caught. Any sorrow that he would have would be that he got caught, and perhaps that his family was sad about it. But he certainly has shows no remorse in that video when he talks about some of the people that he killed and the way that he killed them. Now, again, those are two extremes, but our society has people with antisocial personality disorder in it, and some of them manage to stay out of jail. And so there is I'll talk more about something else I was going to say about that here shortly. All right, so let's go on to borderline personality disorder. Now, I've had the experience of knowing a couple of different people, several people in therapy that has borderline personality disorder, and have also known at least one in my personal life that had that disorder. From a professional standpoint, I can tell you that people with borderline personality disorder can be quite difficult with which to work. And in terms of personal life, it, it can be quite chaotic having friendship or any other kind of relationship with a person with borderline personality. It can be very confusing, very chaotic. In fact, one of the things that I'll say is that as a clinician, oftentimes if you find yourself working with a client and you become, you notice that you're feeling bewildered and confused and all of that, chances are pretty decent that the person you're working with has a personality disorder, and quite likely a borderline personality disorder. All right, so for this disorder, there's a pervasive instability in interpersonal relationships, self-image, and affect. I've seen this personally in people with borderline personality. I know this is accurate. There's marked impulsivity, such as increased spending, impulsive spending, impulsive sex, substance use, binge eating, recklessness. And I've seen witness to several of those things too with some of the people that I've known that have borderline personality disorder. Characteristics include frantic efforts to avoid abandonment. Yep, that sounds accurate with the people that I've known, sure enough. Unstable, intense interpersonal relationships, altering between idealization and evaluation. Yes, I've seen that. Identity disturbance, that's also true. Recurrent self-harm. I haven't seen a whole lot of recurrent self-harm, but I'm not saying that it doesn't exist, at least sometimes with people with borderline personality disorder, but I haven't seen a whole lot of that. Affect instability lasting from a few hours to a few days. Hopefully you know what I mean when I say affect, A-F-F-E-C-T, affect. If you don't, please look it up. You'll need to know that term in your practice. And they also have chronic feelings of emptiness, intense anger that may be difficult for them to control, and sometimes they have paranoia or dissociative symptoms. Now, a person with borderline personality disorder won't necessarily have all of these, but the DSM will instruct you in terms of, will instruct you in terms of how many of these disorders are required for diagnosis. Okay, so I want to move on now to narcissistic personality disorder. And when I think of narcissistic personality, one of the things that I think about is that people with antisocial personality often have really strong characteristics of narcissism, of narcissistic personality. And so oftentimes we'll see 2 or 3 personality disorders together, comorbidity. So anyways, with narcissistic personality disorder, there's a pervasive pattern of grandiosity, need for admiration, and lack of empathy beginning in early adulthood. Some of the characteristics, again, grandiose sense of self-importance, and expects and demands to be recognized and admired by others. And oftentimes they haven't done anything spectacular in order to garner recognition and admiration. Sometimes they're quite normal in terms of achievements, haven't done anything spectacular. They're often preoccupied with unlimited success, power, brilliance, and positive traits. Believes he or she is special and should be treated as such, and that they should associate and be welcomed by people that are special and have done noteworthy things, and or institutions that are prestigious. And so they believe that the people that they run with should be people that are pretty significant and noteworthy people. They have a sense of entitlement. People with narcissistic personality think that they should have their way, that things are about them, the world circles around them in their opinion. Oftentimes that's true. They're often exploitive. They will exploit others for their own gain, and they lack empathy while doing so oftentimes. People with this disorder can be quite envious. It doesn't take much to make them jealous of what somebody else has done or has, and of course they'll want to downplay sometimes the achievements of others. These people tend to be arrogant, haughty in attitude and behavior, and I can tell you from personal experience with people in clinic with this disorder, they are oftentimes very distasteful. You know, you spend a few minutes around a person with this disorder, and a lot of times you'll be left with the feeling of, I just really don't like that person. The interesting thing, though, is that if you can get an idea of their pathology, their narcissism, if you look at it from a clinical perspective, it all becomes very interesting in terms of their behavior and the way that they're thinking. I'll give you a really quick case example of, I've seen several people with narcissistic personality in psychotherapy. Most of the time they don't stick around very long, but I remember one particular case several years ago of a person that came in and was about to face some pretty dire consequences in his personal and professional life if he didn't make some changes in his behavior. And so he came to me and he wanted to have psychotherapy. And so one of the things that I was helping him understand is that in all likelihood he would always believe that he is superior to other people, even though in truth he wasn't. I mean, his IQ was a little higher than average, but certainly nothing to, well, I guess it depends on what circles you're running in, but certainly nothing stellar in terms of his abilities. And so he came into me and he said, I need to do something, or I'm going to be have some pretty untasteful consequences. And so again, I helped him understand that the way he thinks about himself may not change, but that he has the power to make change in his behavior. And so, for instance, if he's having trouble with his interpersonal relationships, he can think that he's superior or better than ever who he's talking with if he wants, but the key is to not act that way, to not manifest that in his behaviors, and for him to work hard to act appropriately, to interact appropriately with that person or those people. And so we worked on that for a while, and he would come in and report progress and all of that. And then one day he came in and said, you know what? This is just too difficult, and it's just not me. And he says, I'm going to stop coming to therapy. This will be my last time, and I'm going to go to the way that I was, because that's the way that I enjoy being. And he said, I'll take the consequences that come with that. And so sure enough, he stopped coming to therapy, and I would assume that his marriage ended, and I would assume that things didn't go so well for him in terms of getting along with others. But that was his choice to make, right? We can't force our will on clients. It's not appropriate to do that, at least in most cases. Okay, so in terms of treatment, treatment is difficult at best in terms of outcomes, and outcomes tend to be poor with people with personality disorders, partly because the disorder is ingrained in who they are. And like I said a minute ago about narcissism, I mean, people with personality disorders are, at least in some ways, and at least for some of the disorders, unlikely to change the way that they think and perceive things. But it's up to them to say, well, okay, I don't want the consequences of the behaviors that are related to the way I think, and so it's up to me to change those behaviors so that I can function at an acceptable level and not bring problems upon myself. And so I'm thinking of dialectical behavioral therapy by Dr. Marsha Linehan for treatment for borderline personality disorder. And I understand that of late this type of treatment is branching out to other aspects of pathology, psychopathology. But I remember years and years ago when DBT first came out, started to get popular, and this is when it first started to get popular. I went to a training on that, and it at that time didn't suit me in terms of the way that I look at psychopathology and treatment. I understand that since then there have been some significant changes to and developments in DBT, and that perhaps it's a lot more useful than it was back when I first encountered it. But if you're interested in DBT or think you may be interested in it, there's certainly plenty of research out there on this type of intervention. Also, when I think about treatment for personality disorders, especially antisocial personality, I think of the work of Dr. Stanton Seminow, and I may have mentioned him to you before. He wrote a book called Inside the Criminal Mind, and he's written several others as well, all of which are quite useful and have informed me in my work as a psychotherapist. I would recommend that anybody that's interested in understanding how antisocial personality works and working with those kind of people that have that disorder, that you read Dr. Stanton Seminow's work. It's certainly well worth it. And the books are actually quite inexpensive. You can get them off of his website. And no, I don't get any kickback from any of that or anything. I do. I have had the pleasure of talking with him a time or two via email, but he's a very brilliant person and certainly one that has contributed to our knowledge of antisocial personality. So that's the fascinating world in a nutshell of personality disorders. I encourage you to read more about them, to learn more about them. Hopefully you'll have ample opportunity to have clinical experience with those and so forth. Okay, well, please remember to do your readings. You have plenty to do, plenty to learn. Go forth with gusto. Take care.